Perfect. So my name is Malik. So I manage technology, and last 2 weeks I'm also responsible for the business. So it means I'm able to put technology and business together and see how do we help the industries to really shape up and adopt technology. For me, 5G is a very strong pillar of technology which enables not just from an access perspective, but enables the industries at large. So 5G, cloud, and AI are really at the center of everything right now. When I'm coming from this 6G Health Institute, I mean, we've been collaborating with Christoph for the last few years in terms of trying out different functionalities of technology and how does technology help the healthcare industry. For us, the most important thing is working with institutes like 6G Health to try out different technologies. I think that's what excites me and interests me. However, 6G is a technology which is just coming in at least 5 to 6 years before it is deployed at a large scale. We took about close to 3 years to get a 99% of Germany's coverage in 5G. And it is really a time where we work together as industry and see how can we help the patients, how can we help institutes to really fructify, and as a result, we make a technology to serve the societies. I think these are two industries, right? You have the telecom industry and healthcare industry. The center of our industry, or the commonality of our industry, is trust. Without trust, we don't exist. I think that's really important. When you take about healthcare data, right? For patient data, it's a highly confidential data. How do you treat these confidential data when you are putting into digital form? And that's what telecommunications can really play a big role. On one side, we have the healthcare data. Other side, of course, we do manage day in, day out the customer data for every microsecond of interactions in telecoms. So if these two industries are coming together, we appreciate a lot of security, privacy, encryption, sovereignty of data. We have been trying out something called confidential computing, wherein you have a data, you can essentially secure the data when it is rest, when it is in motion, when it is in transit. And that's what we have done in telecommunications, particularly in Germany. We pioneer across the world with the hyperscalers. I think that is the technology which we can bring it to the healthcare to see how does the data security happens, how does the keys of the security is with the user, is with the institute who is providing this data. The other big thing which is happening in the industry is, apart from the connectivity, right, in the rural areas or disaster areas, when you have disaster strikes, it's extremely important for us to provide the connectivity contiguously, connectivity confidently connected. So that is where we as an industry, between let's say Vodafone, Deutsche Telekom and Telefónica, when a disaster happens, we have a framework that we collaborate with each other on one side. Second side, what is happening is non-terrestrial networks, the satellite networks. We are integrating all these connectivities into our core networks, wherein when a disaster happens, you rely on different technologies. So that's how we're able to provide a confidently connected experience at any point of time in the country, any point of time if you're roaming outside the countries. So that's how these industries are developing. That's how I think we bring these technologies forward for healthcare industry, specifically because both of us rely on trust. So what happens is, we have been, when healthcare industry or a specific industry demands a connectivity which is assured or or a connectivity which is dedicated, prioritized. There are a number of ways to achieve these things. Earlier, about 2-3 years back, we've been working with the 6G Health Institute with campus 5G networks. So we have deployed campus 5G with a campus spectrum to say, okay, this is dedicated for you. However, as the technologies keeps evolving, we have something called extremely nice called slicing. In a slicing where you're able to dedicate a network, a piece of macro network, because private 5G or campus networks are limited in one area. And the killer application or the biggest use of mobile technologies is about mobility. You're not restricted into one place. So that is where we have worked with the 6G Health Institute to develop a slice which is on the macro network, dedicated with data security, privacy ensured, so that you can move from one campus to another campus seamlessly. Even while you're moving, your dedicated slice serves you to ensure the confidentiality, security, and privacy. So that is what I see in next coming years. The more and more we start using these slices, we can do every healthcare institute can have its own slice, can have its own network, so that we manage the network, because network is a living and breathing organism. So it is not easy to just deploy and leave it. It has to be managed, it has to be curated, it has to be protected from cyber attacks across the globe. And that's our day job. That's what we do. So giving these advantages to a slice to make sure you have a dedicated network which is highly confidential, which is highly secured, and ensuring the data privacy. So that's the future of the network slicing as it evolves. I mean, as we've been discussing with Christoph in terms of how do you manage the health data. Now, data is not necessarily dependent only on access technology. Whether it's 5G or 4G or 6G, these are access technologies. Clubbing these access technology with the core technologies, I think that's the most important thing. In telecommunication, we do have something called landing zones. In every hyperscaler, whether it's AWS, Google, or Azure, we do call a landing zone in which we keep our data with security, with data privacy, with confidential computing kind of vision which we have and which we have been deploying. That is what we would like to extend to the 6G Health Institute, where you take the data of the healthcare and then provide in our landing zones in terms of wherever it is. It could be on-prem, it could be on the cloud. However, this is accessible across. So once you secure a framework of confidential computing with the healthcare data on-prem, on hybrid, right, and accessible to everywhere, anytime, across the borders. That's easy because access technologies are secure from an air interface perspective. So the most important thing, I think, which we should work together is how do you secure at the core infrastructure? How do you make sure the core infrastructure is shareable across the place with security and privacy? I mean, if I take myself, in next 10-15 years, if I have to walk into a hospital or any care facility, I would expect personally that they should know about me before I enter there. Right? That's the most important thing, because the more you know, the more the doctor knows about the patient, the better patient care you could give. Now, similarly, same thing happens in telecommunication all the time. Our users tell us, guys, you should know when I have a bad experience when I'm traveling. When I'm moving from one country to another country, you should know. However, the most important thing is, how do you make sure the data which I know, everybody knows everybody, honestly. In the internet, everybody knows everybody. However, the privacy is not there in the internet to a large extent. While we have GDPR, while we have all the standards, but it looks like we become consumers in the internet. And that is where the biggest development has to happen. Again, for me, when I go there, doctors should know me much better than I know myself. That's how I see it, my healthcare evolving in the next 10, 15 years. Of course, there are some events which are happening today in some of the places where I go in different markets. These things have started happening, but at a massive scale, it takes time. It takes time because of the privacy, nothing else. Technology is available. Technology can support the data transitions. Security, privacy is significantly important, and that's what we have to work together.